It's Lisa with Lisa Heal Yourself, and today we are going to be doing a 10-minute somatic tracking exercise. You should do this breathing and somatic tracking exercise several times throughout the day if you're very symptomatic, if you're living in a hyper alert, sympathetic dominant state, what we call activated state, the red zone, constant symptoms, then you want to check in with your body many times throughout the day. You do this when you're in an activated state, you do this when you're feeling a little bit better, you do this continually no matter what the symptoms are doing. So you might do it at 9 o'clock, you might do it at noon, 2 o'clock, 5 o'clock, and so on. You want to start by just taking a breath in, a small breath in, okay? Not to fill up the lungs. So hands on your stomach, take a breath in. It comes in here like a bowl. You can even put your hands here on your hips. Try again. And then exhale. When you exhale, this is where the magic happens, and you want to do it through yoga breathing. This is like a Darth Vader voice. This is what they call pranayama breathing. So when we breathe in, just a little bit, we hold it a little bit, and then, I don't know if you heard that, kind of make a growl in our throat. Exhale for as long and slow as you can. So let's take 10 deep breaths. In. Exhale. Breathe in. Exhale. Breathe in. Exhale. Breathe in. Exhale. Breathe in. Exhale. And now just some normal breaths. A couple sighs. And one more. Okay. Find a comfortable spot and let's settle in for somatic tracking. And so now that you have found a comfortable spot, just close your eyes, whether you're sitting or lying down or in a recliner. Anything is fine. Just breathe into your stomach. Breathe into the area that hurts. I want you to locate now where your sensations are. You may have them in your head or your neck. You may have them in your stomach or your heart or your nerves or your skin. It doesn't matter where the dominant sensation is. Just try to locate it now. If you have several dominant sensations, just pick the one or two most dominant. Now that you have it narrowed down to 2 sensations, I want you to focus in until one grabs your attention the most. When you're focusing on the sensation or symptom that has the majority of your thoughts and your attention, I want you to see if you can turn towards the symptom and recognize it as a sensation. If you can turn towards that body sensation now and notice exactly where it's located and exactly what area of the body it's in. Notice its size. Notice its intensity. Notice whether it's still or it moves. Maybe it swirls. Maybe it pulses. Maybe it vibrates. Just notice. And once you've got the sensation and you know how big it is, notice whether it's changing. Notice whether it moves. Notice whether it intensifies. And notice whether it diminishes or changes or transforms. Maybe it spreads out. Maybe it lessens. Or maybe it speeds up. Maybe it intensifies. Whatever the sensation is doing is fine. The point of somatic tracking is to allow yourself to notice these sensations without fear, to allow them to be either soft or very, very loud. You want to allow the sensation to do and be whatever it needs to be while we stay centered and grounded. We choose not to react or respond or try to fix or change or make this sensation go away. And by doing this, we teach our brain very slowly that these sensations are safe. We rise above these sensations and watch them the way we might watch a movie screen, the way we might watch somebody outside, walking outside, as we sit and look through our window at them. We notice. We know we don't change anything they do or try to fix it or interact with it in any way. We just allow it to be what it is as we watch from a separated, higher place. This is the magic of healing. And whether it goes away or whether it intensifies is not the point. The point is that we allow it to be what it is. And so now we look deeply at this sensation and we see it for what it is. We see it as a sensation that can't harm us, that is there simply to warn us and to talk to us. And we look at that sensation now and we say, I see you. I see you. I hear you. I'm listening. And now we soften towards that sensation. And we see if we can show it care and kindness and even love for how scared this sensation is in your body. And we say to the sensation now, you are safe. You are safe. Everything's going to be okay. I love you. I'm listening. I know it's been hard for you. I know you want me to see you and to understand and to stop trying to fix you, to change you, and to quiet you down. We acknowledge now that this alarm, this fireman, is only trying to protect you, is trying to alert you to danger. We see and feel the intensity. We continue to stay grounded and say, you are safe. I hear you, I'm listening, but you are safe. I am safe. It's okay now to relax. It's okay now to let go. It's okay now to soften and allow and let go, because I hear you, but you are safe. I am safe. We are safe. And whatever the sensations do is okay. You are okay. We are just noticing, just watching, just allowing. We are teaching our brain that it's okay to feel these sensations, whether they're intense or whether they're not. We are safe to notice them without responding or reacting or causing more fear. That is the key. We are teaching our brain that we can look at these without more fear. You are safe. They are safe. You are safe to watch as the symptoms and as the storm passes. And so now, just take one more moment to breathe into the sensation, to give it space, to give air around it. Breathe in to the sensation one more time. And whatever the sensation does is okay. We just follow and track it as it moves, as it changes, as it intensifies, and as it dissolves. And as you open your eyes, look around the room, orient around you, sit up. If you were sitting, maybe stand up and move about your day. Just continue on, remembering that we can always come back to our sensations. And the key is not to fight them, not to try to change them, not to try to get rid of them, just to allow them to be, giving them space, knowing that they're not harmful to us, knowing that they just want to be seen and heard and felt. And as we do this, and the more we do this, they move through us. So I hope you enjoyed this video. If you did, give it a like, subscribe, and come back and do this video often.